All right, good afternoon, everyone, and thanks so much for making the time to join today's webinar. It's a patient safety webinar, and the focus is going to be on infection prevention and control. My name is Barbara Savannah. I'm also an IOSH Public Services Community Member, Head of Public Health and Occupational Health and Safety, Lekma Hospital. And today I'm going to be with you, and I'm going to use the most simplest of languages to help you understand infection prevention in terms of patient safety. So to begin with, let's just go through the outline of today's discussion. We are going to be talking about next slide, please. Yeah. We are going to be talking about the guidelines and policies, featuring recommendations and standard definitions tailored to specific facilities. Also, hand hygiene is going to be featured. Surveillance of surgical site infections, monitoring of negative bacteremia, antimicrobial stewardship, and also antimicrobial resistance is going to be addressed. We're also going to look at healthcare associated infections and also IPC being a multidisciplinary teamwork. We'll also talk about auditing and then also an important aspect, which is training and supporting the IPC champions to achieve their aim. So, the next slide, please. Okay, thank you. So, patient safety is a global observance, and it's instituted by the WHO. And each year in September 17th, it is celebrated. We are still in the month of September, and IOSH deems it fit to also organize a webinar on patient safety. And the goal for the celebration is to reduce avoidable harms in healthcare settings. It promotes policies and practices that protect patients and engage various stakeholders. And this year's theme for patient safety is safe care for every newborn and every child. In fact, it's tailored towards our children. And the slogan is patient safety starts, um, patient safety from the start. Yes, that is right from when you are born. That is where your safety becomes a concern. So patient safety basically is about creating a system where care is effective, error-free, and respectful. It aims to minimize risks of harm to patients in the healthcare setting. It's like, okay. So we are talking about the pillars of patient safety after knowing what we are going to do today. Patient safety is very broad. It has about 9 pillars. We have this safe system and culture pillar, the communication and teamwork. We have medication safety. We also have the infection prevention and control, which is going to be our focus for today. We also have safe clinical practice, and the other 4 pillars include, next slide. Yes, we have patients and family engagement, workforce safety and training, and then the use of technology and data, and then risk management and learning. Today, our focus is going to be on IPC, which is infection prevention and control. We can't talk about all the 9 pillars in less than an hour. And so we are going to focus on IPC for today. Next slide, please. Yes, thank you. Patient safety is a cornerstone of healthcare, ensuring the well-being of both patients and healthcare workers. And we emphasize evidence-based strategies to achieve this goal. Yes, and also as an occupational health aspect. That's why I bring my expertise on board today to take us through infection prevention strategies that's adhere towards patient safety. And all these are evidence-based strategies. And these strategies ensure the safety of both patients and healthcare workers. So to begin with, let's look at the key challenge of patient safety. Next slide, please, which is healthcare associated infections. Yes, so Healthcare associated infections. What is this? This is simply infections which are acquired whilst receiving medical care in a health facility. And this remains a significant concern in UK health system. These infections can lead to prolonged hospital stay and increased healthcare costs. Again, we have one major challenge, which is antimicrobial resistance. And this also in simple terms, is also when microorganisms change over time and stop responding to the medications that were previously effective against them. This is also posing a great threat to patient safety. It limits the effectiveness of treatment, making infections harder to control. So now let's look at some solutions. Next slide, please. Yes. So to help curb this challenge, there's a need for consistent infection prevention control across all care settings. Now we have the high volumes of patients in healthcare settings, and this significantly increase infection spread and risks, requiring a robust prevention and control measure. Integration of patient safety partners as mandated from 2025-2026 is also an important initiative. This initiative aims to enhance collaboration and then accountability in the healthcare system. And as we mentioned earlier, high patient volumes amplify infection rates in healthcare environments. And so we need to really look at reducing the number of patients in a healthcare facility at a particular time. Next slide. And in doing this, we will need to engage as patient safety partners. All NHS trusts must appoint and work with patient safety partners. This initiative aims to integrate patient perspectives into safety protocols. And again, an enhanced framework, it involves an enhanced framework for involving patients in safety work, and this needs to be implemented. And this framework is for this year and is also through to 2026. And it ensures that patients play a central role in shaping the safety measures whilst they are at work and whilst they are with us in our facilities. Mandatory adoption of NHS inland infection control guidelines is also required. And these guidelines aim to standardize and improve infection prevention practice. Then again, we also have the Matters Rule, which will be implemented across all acute hospitals. This rule empowers patients and families to request a second opinion in critical situations. And as most of us may be aware, Matters Rule is named after Martha Mills, a 13-year-old tragically died from sepsis complications, which her parents felt that their concerns were not addressed properly. And so this rule has come to stay. Next slide, please. Yes, so the purpose of Matters Rule, patient safety measures created to keep patients safe and then build trust between the NHS, its patients, and also their families. It acts as a mechanism allowing patients and families to voice concerns that may otherwise go unheard. Matters Rule also reduces misinformation and increases patient advocacy. In totality, it ensures that concerns are addressed effectively, fostering better communication. And indeed, Matters Rule is a positive leap towards enhancing patient safety. And in achieving patient safety with all this in mind, we cannot talk about IPC without talking about hand hygiene. And so it's a major aspect of hand IPC. And so we are going to take some time to go through it. Can I have the next slide? Thank you. It's a universal requirement. And if I may ask today, have we all here washed our hands? I have, yes. Hand hygiene plays a crucial role in maintaining health. In fact, your health is in your clean hands, and clean hands are a key to a healthier life. So if you've washed your hands today, there are some few steps that you use to in washing the hands. We go through it very briefly. And in our healthcare facilities, there are some 5 moments that at least during these moments, one is expected to wash their hands. And this is highlighted here. The first one is before you touch a patient, and then before a clean or aseptic procedure. Again, after contact with body fluid, also after touching the patient, and also the last bit is after touching the patient's surroundings. All these times you actually need to wash your hand. So what are the steps? We have to go through it because hand hygiene is a universal requirement for the healthcare workers, for the patients, even their family members, their friends, their relatives. And so we need to take some time, actually go through it so I will have an in-depth understanding about it. You just take an ample amount of soap. If let me even demonstrate it here, I have my sanitizer. It's the same process with the same step. The only difference is that with sanitizer, you don't need to wash your rinse your hands afterwards, but with soap, you definitely have to rinse your hands and dry your hands. So you take enough that you need. You just rub your palms together. It's very quick. You rub together back of the hands, interlock your fingers, cup your fingers in your tap your fingers in your palm, you clean your thumb, then you rub your hands, your palms, you rub your palms with your fingers, and then you are done. You leave them to air dry. It's so simple, and this simple method can take care of infections to a very high degree. So each one of us, after this webinar, if you haven't washed your hands today, kindly take some 20 seconds and then just get sanitizer or soap and water and get your hands washed. There's a lot of importance in washing your hands, even for the 5 moments. Before you touch next like this, next slide again. Yes. So before you touch a patient, you prevent transmission by washing your hands. You ensure that the patient is safe by maintaining the hygiene protocol. And also before a clean aseptic procedure, it also ensures that you have a sterile condition to avoid infections. And then after exposure to body fluids, you also wash your hands to protect the healthcare worker and also others from contamination. All this minimizes the spread of harmful pathogens. Next slide, please. Yes, and because hand hygiene is so important, there's also a campaign for it. And this year, our campaign the campaign team again for NHS and WHO is it might be gloves, but it's always hand hygiene. This emphasizes the importance of hand hygiene even when gloves are used. So this campaign aims to reinforce the critical role of hand hygiene in healthcare. There are times you will need to wear gloves, but yet the hand hygiene can never be substituted with gloves. You need to actually get your hands cleaned with water and soap or with hand sanitizers. Now let's move to our PPEs, which are also an important aspect of patient safety. Next slide. So when you come to our health facilities, you will see us in some PPEs, and this you wear them all for your protection and safety. So proper PPE selections I can use to protect the healthcare worker and also the patients from infection transmission. It serves as a critical barrier against the spread of infections in the healthcare setting. So we have the gloves, we have masks, we have aprons, we have gowns, also have eye protections. All these are geared towards preventing risks. And each item is designed to address specific risks and ensure the comprehensive protection. So when you see us in the PPEs, it's for your safety and nothing else. Next slide. Yes. So talking about these standard infection precautions, we've talked about hand hygiene, we talked about PPEs. We are going to talk about risk assessment as well. It's also an important aspect if you want to maintain patient safety. Next slide. Yes, so risk assessment. It's prompt evaluation of infection risks on patient arrival and is essential to prevent transmission. Early identification of potential infection risks guides appropriate precautions and care planning. Yes. And so when infections are detected early, you are able to prevent it from spreading. Prompt evaluation of infection risks on patients' arrival is essential to prevent transmission. So immediately you arrive, we evaluate your risks and then quickly the safety precautions starts from there. Effective care planning relies on early detection of infection risks, enabling healthcare providers to implement targeted precautions and interventions promptly. This proactive approach minimizes the risk of infection spread and enhances patient safety throughout their care journey. We are going to talk about our environments too in context of IPC. Next slide. Yes. So in our hospital settings, our environment is also crucial. Ventilation is an important aspect. Good ventilation helps to reduce airborne pathogens. It's essential for maintaining clean air and preventing respiratory infections. We also have our water safety, which also focuses on risks like Legionella in healthcare environments. So we need to prevent waterborne infections through monitoring and control. We also have our surfaces. We need to limit microbial survival on frequently touched surfaces. We have our workstations, we have our bed stands, and our bedside trolleys. So these also need to be frequently cleaned to ensure that they are free from from microorganisms. Also, we have the patient space design. This minimizes infection risk throughout the layouts and then material. So when the space, the world environment, the emergency environments are main service deliveries, the space is designed with IPC in mind. Yes. And this supports infection prevention by optimizing healthcare environments as well. Still on the environment, next slide. So our environments must be clean, to reduce infections in the most simplest languages. Regular cleaning and disinfection of equipment and surfaces is crucial. And so the design should also be appropriate. There should also be there should be well laid out, and also the icons of the design or the icon of twin hospital rooms, the bullet points, and those things should be clearly seen so that you will not mistake a blue for a red. The layout will be visible for everybody, even both for the patients and also the caregivers and also their relatives and friends. Next slide. Yes. And again, on our environment, correct segregation and disposal of healthcare waste prevents contamination. And then this practice also mitigates the environmental hazard. And adhering to protocols ensures safety for staff. Adherence protects patients from potential risks as well as the staff that take care of them. And so it's important for us to consider design when also taking and having IPC in mind. You should use waste segregation icons and a clean layout. Maintain consistent spacing with blue and gray palettes to avoid errors. When they are too close, you may end up putting a blue in a gray. So there should be enough spacing. Icons should be visible and readable to avoid errors. Now we've talked about hand hygiene, we talked about waste. Let's see our linens. Yes, next slide. It's also an important aspect of hand IPC. Proper handling of contaminated and clean linens also prevents cross contamination. And there are protocols to this effect, and protocols include segregation, storage, and laundering standards. Segregation of linen is essential to maintain hygiene and safety. And also the storage and laundering standards ensure effective contamination control. And adhering to the linen management protocols minimizes the infection risks. And again, here, icons and clean layout can also help highlight these key practices very effectively. So when you go to where learnings are stored, everything should be clear and then well laid out so that there is no proper segregation, and then also the standards are maintained according to the protocols. Next slide. So standard infection control precautions must be implemented by everyone across all care environments. And this needs to be consistent for every patient, irrespective of the patient's social-cultural background. It is for it's same for everybody, and this universal approach ensures a comprehensive infection prevention. Design includes inclusive iconography representing diverse healthcare workers. Yes. So in learning management, we also have to have in mind maintaining our protocols, also having designs for healthcare. Clear text should be present with blue-white background for better readability. There should be no doubts, and they should also avoid errors. And in doing this, all this is geared towards infection prevention. So consistency is important, and that is the main key to effective infection prevention and control. Adherence to all protocols and being consistent with adherence is the key to infection prevention protocols. Next slide. So now we have some key surveillance areas, and also we have some benefits. As we've mentioned some, we are also going to talk about some later. But in general, when, for instance, post-operative wound monitoring, yes, when you have your risk assessment, there's early detection, and then you are able to prevent infections and also outbreaks. That is the benefit. The risk factor identification also, there is benchmarking against national standards, and all this helps to check and then audit the IPC. And then we also have the E. coli bloodstream infections, and these also are based on evidence-based policy developments. And so through practice, precautions and protocols are put in place to prevent these infections from occurring with patients who are in our care. We also have we may also have some outbreaks. Next slide. And in terms of outbreak, what are we going to do in patient safety? I'm sure with COVID-19, we saw, I mean, every one of us have seen someone dressed like this before some few years ago. And this is outbreak management, yes. And in outbreak management, IPC is also very important. The first most important thing is rapid identification. Early detection of cases is essential to limit the spread of healthcare outbreaks. And then timely identification allows for immediate intervention and containment measures. Then the IPC response team comes in. It's a multidisciplinary group, and it's mobilized to manage the outbreak effectively. Each team does its work effectively to ensure a swift and organized response. So in an outbreak, IPC is also very important. It's important for, so there's also enhanced cleaning protocols is also very important. And then there's also case study insights. Yes, MAC and novel virus outbreak underscores the importance of swift action. Teamwork and coordinated responses are very vital in managing healthcare crises. And isolation is also very important. Segregation can never be taken out of IPC. Isolation protocols needs to be adhered to strictly in managing outbreaks as well. So we've talked about outbreaks, we've talked about hand hygiene and a few other things. What about our surveillance of our health associated infections that was mentioned earlier? Next slide. So as we talked about health associated infections, one way that you can also improve upon our work in terms of IPC is by just following the five rights in treatment. You follow the right drug, the right dose, the right duration, right route, and the right time. And then you avoid unnecessary prolonged treatment to prevent resistance and also reduce side effects. And there are times when you even need to balance therapeutic benefits with potential risks. Yes. And using the right route is also very important because it enhances the drug effectiveness and patient compliance. Most of most of our antimicrobial resistance is because there's ineffective patient compliance. Sometimes it's even due to the times of the treatment. And also the right time is also improvement. So important to improve outcomes and also improve compliance when it is given at the right time. So surveillance of healthcare in terms of these associated infections and maintaining the five rights of drug administration is one crucial aspect of IPC. Next slide. Again, with our gram-negative bacterials in the healthcare setting is also very common. Gram-negative bacteremia is the presence of gram-negative bacteria in the bloodstream causing infection. And this is being discussed because common sources include urinary tract infections, respiratory infections, abdominal infections, also intravenous devices, which are used mostly in healthcare settings. And these sources can introduce bacteria into bloodstream, leading to bacteremia. There are lots of symptoms that you can have. You can have fever, chills, your blood pressure can be lowered, and others. And when these symptoms are recognized early, then effective treatment is given. Yes. Prevention includes strict hand hygiene, aseptic techniques during procedures, timely catheter removal, and antimicrobial stewardship. Implementing these steps can significantly reduce the risk of gram-negative bacteremia. This is very important to reduce our hospital-acquired infections. And in maintaining all this, digitalization in IPC is also very important. Next slide. So now we have digital tools for infection prevention. We have the EHR alerts for infection risks. It notifies clinicians of infection risks and precautions. These alerts enhance awareness and timely response to potential threats. We have the AI-driven surveillance, which is done, and this technology enables proactive measures to prevent infection spread. We have real-time data dashboards that provide real-time data visualization for informed decisions. They empower healthcare team with actionable insights. And we have the coordinated facility data sharing. This also it's the collaboration of this strengthens the infection prevention and control strategies across the facility. Yes. Facility data sharing promotes coordinated responses across the department such that anything it is easily seen and then action is taken immediately. So these tools are used for infection prevention and control. Yes. And then again, surveillance is very important. Our surgical site infections, we mentioned a bit of it and we'll add on to it again. Next slide. Yes. So monitoring these surgical site infections as an aspect of IPC and healthcare associated infections is very important because um, implementation of robust surgical site infection surveillance programs helps to improve outcomes. And the key strategy for this is to focus on monitoring infection rates and conducting risk assessments on surgical sites. Adhering to established guidelines is very crucial for success, and then these efforts help effectively reduce the incidence of surgical site infections. And also the design is also important. We have charts or icons showing trends, clear layout, consistent with overall theme. So it's easy to identify. Is you just look at the trend and you can see that action needs to be taken. So comprehensive patient safety and infection control are vital in healthcare. Surgical site infection programs play a significant role in achieving this goal. So healthcare systems must prioritize infection prevention strategies. Effective surgical site infection programs contribute to overall healthcare quality improvement. And also this also reduces the hospital-acquired infections as well. Next slide. Now to the strategies that can be implemented. So it can start from globally. We have the WHO leading the front, and they have recommendations that provide evidence-based guidelines for baseline for IPC, and that is because we all base our protocols on. These guidelines serve as a foundation for infection prevention. And then from globally, we also have the national NHS adoption tailors these standards to UK healthcare settings. This ensures relevant applicability to local healthcare environments. We also, so globally, we also have international collaborations. International learning fosters innovation, shared solutions to common challenges, and such collaborations enhance the effectiveness of FPC. And we have consistency in practice, which is also very important. Aligning local practice with global standards ensures consistency and quality. We can't be in our own small world doing our own thing. No. This alignment supports uniformity in infection prevention efforts. And this synergy strengthens patient safety and infection control efforts globally and then locally, and then we see its effects. It highlights the interconnectedness of global and local IPC. So when you talk about IPC in my home country, where I'm coming from in Ghana, basically it's the same going through with the UK standards. There's no much difference. The only difference may be local content. Yes. So now what's the roadmap? Next slide. So we have a roadmap. So the 5-year National Action Plan addresses the growing threat of antimicrobial resistance through coordinated stewardship programs. So one of the roadmaps is just towards antimicrobial resistance. And this strategy roadmap emphasizes sustained efforts to combat resistance, ensuring effective treatment remain available. There's also a focus on surveillance and antimicrobial use. So these focus areas include enhanced surveillance to monitor resistant strains. Optimized antimicrobial use is prioritized to safeguard patient safety. And then we have the cross-sector collaboration for patient safety, which is a key component to address antimicrobial resistance. One person can't do it all. So these efforts aim to ensure effective treatment remains accessible for even future generations. That is where antimicrobial resistance come in. So let's talk more about it. Next slide. Yes, so we have the prevalence of surgical site infections, and this also comes under antimicrobial stewardship and resistance. And surgical site infections, as we already mentioned, are the most common hospital-acquired infections, accounting for 20% of documented infections each year. These infections significantly impact patient recovery and healthcare system. There's also the prolonged stay on our facilities. And the causes, this development bacteria infiltrate the body through surgical incisions. And sources include the patient's skin, surgical treatments, or the environment. So basically, a surgical site infection is an infection which is definited as um, which starts within 30 days post surgery, and it can also extend 90 days if there was an implant involved. So any infection is a later surgical site infection if it develops at the surgical wound site within 30 days post surgery, or in case there was an implant, then it becomes a 90-day. Yes, this is very, very important. And so we need to address it and then ensure that all our surgical cases do not develop infections after procedures. All our wounds are healed with first intention, are healed by first intention. And this is a teamwork approach. And so, next slide. It involves a multidisciplinary teamwork collaboration. IPC and patient safety is not a one department business. We have antimicrobial pharmacists, we have microbiologists, we have infection control specialists, we have the clinical team. All of them form the backbone, and their expertise ensures there's comprehensive care and effective infection prevention management strategies. And communication is also very important. Yes. So regular multidisciplinary team meetings are held, and then there's shared decision making. There's clear escalation pathways and documented care plans. This enhance coordination and accountability. Feedback is also an important aspect because it also dwells on quality. Feedback mechanisms are integral to refining care plans and also improving team dynamics. They ensure adaptability and then responsiveness to patient needs and evolving healthcare challenges. And then there is the collaborative approach where we all bring our heads together, and this also contributes to lowering the overall healthcare costs. Yes. And escalation pathways also is an important aspect of collaboration. There are defined pathways for escalation, and this ensures timely interventions and prevent delays in care. These pathways are crucial for maintaining high standards of patient safety and treatment efficacy. Immediately you see something that needs to be escalated, quickly you inform the next line of action, and then an action is taken immediately to improve patients' care, also reduce time of stay, and also prevent infections from developing. Next slide. So after doing all this, there needs to be auditing and continuous quality improvement. We need to see what we are doing is yielding some results. So we have some key performance indicators that will need to be audited. And these the key performance indicators guide systemic improvement in patient safety outcomes. They serve as benchmark to measure and enhance infection prevention and control practice. Now we also have the impact of regular auditing. So we following our performance indicators is one. Also auditing. Regular auditing creates accountability, identifying gaps in healthcare practice. And this process actually drives continuous enhancement of infection prevention and control measures. Without auditing, we will not know where we need to improve and what we need to even change. Then fostering a culture of quality. When adherence to standards ensure a culture of quality and safety within healthcare settings. Continuous improvement efforts promote better patient outcome and organizational excellence. Yes. That is for auditing. Let's go to training. Next slide. Yes, our IPC champions need to be trained. So we have peer education and mentoring. We have the best practice demonstration. We have issue identification and reporting, quality improvement participation. There is e-learning models with flexible baseline training, simulation exercises, providing hands-on practice. And then there's also the word-based teaching for real-time learning. And then we have the peer sessions, encouraging knowledge sharing. All this is geared towards improving the champions and also giving efficient delivery of care. There are also a lot of well-being programs for staff. Next slide. Yes, so we have vaccination programs. We have vaccination programs for staff, and this reduces the risks of transmissible infections among staff. And this ensures a healthier workforce and minimizes the spread of disease within the healthcare settings. There's also the mental health support that addresses stress and burnout in demanding environments, providing resources for emotional well-being, enhancing staff performance and satisfaction. There's also empowering staff in IPC. And then there's also impact on patient outcome. So a safer staff contributes directly to safer patient outcomes and quality. Prioritizing well-being strengthens the entire healthcare system. Next slide. Let's see some scenarios. Yes. So in the education process, we can have interactive case scenarios. We can take a case like PPE misuse consequence, and in this we can engage with real life challenges to deepen understanding of IPC. We can take an instance and then explore the consequences and then correct practices of PPE misuse. So this is a case scenario based, yes. You can also take an instance for surgical site infections, identify a risk factor and prevention strategies for surgical site infections. And then participate in the scenario discussions. During these discussions, you look at what should have gone, what went wrong, what should have been done, and then way forward and how to improve the situation to prevent another occurrence. So in these kind of scenarios, it's interactive and it's a very good learning session for those who participate in it. And it's all geared towards improving patient safety. And we can also talk about the visitor hand hygiene refusal, discuss communication and also enforcement approach for visitors refusing hand hygiene. We have instances where visitors will refuse to wash their hands. Some will say, oh, I just washed my hands at home before coming to the hospital. Some will say, I washed my hands downstairs. Yet we are also insisting they wash their hands because of maybe where they are coming to the high dependency area. And so we need to have discussions with our visitors, our patient relatives. And then together, it's supposed to be an interactive session for them to see the importance of hand hygiene. So this kind of scenarios also help in improving IPC and also helps in education, both for staff and also patients, their relatives, and also their friends. Now let's look at some challenges and solutions for implementation of IPC. Next slide. So we have some common challenges. Generally, we have staff workload pressure. It is known worldwide, not just in the UK. And then we have leadership engagements. We have senior management commitments, and the commitment is there, it is seen, and helping to reduce the workload pressure. And aside even reducing the pressure, they are also instituting mental health, mental well-being, all to help the staff to be sound and then also reduce the pressure. There is a resource constraint. It's also globally. There is the behavior change resistance. There is communication barrier. We have cultural change, learning focused approaches, and then we have the resource investment. So now we are talking about investing more in staffing where the need is more. Then there is data driven decisions using surveillance data. Yes. In IPC and also in patient safety, everything should be evidence based. And in evidence based data, yes, and we can get data through surveillance. We have more success factors to consider. Next slide. So we have individual actions that can be taken. we are going to end with this slide. So the individual actions, we can all commit to hand hygiene excellence, and then we can stay updated on IPC guidelines. We can speak up about safety concerns, participate in audits and trainings. And then as an organization, you can adopt the NHS England frameworks, invest in training programs, implement surveillance systems, and also engage patient safety partners. All of this in totality, when rightly implemented and adhered to, is going to enforce IPC. We are going to prevent infections, and then in general, patients are going to feel safe in our care. Thank you very much for your audience.